Hi, in this video I'll share with you what muscle knots are, then answer the most common questions people ask about them, like why do they keep coming back and how do you get rid of them permanently. Now here's a list of things I'll be covering. Now for each of these I'll give you a simple straight to the point answer and then have links in the description to where you can get more info. Now question 1, what are muscle knots? Now they're those tender lumps in your muscles that therapists find. Now while they feel like a knot, they're actually part of your muscle that is tightened and won't let go, bunching up to form a lump. Now this causes the muscle itself to tighten, which presses on the blood vessels restricting blood flow. Now what you end up with is a bunched up ball of muscle, the whole muscle being tight, and a build-up of waste products and a lack of nutrients caused by the reduced blood flow. Now I'll put a link to the extra info in the description. Now they're all science-based articles, so they'll use the technical term for muscle knots, which is myofascial trigger points, or trigger points for short. But you'll know that they mean the same thing. So what causes muscle knots? Now there are many causes, including injury, muscle overload and emotional stress. But the biggest cause is where the muscle tightness restricts blood flow. Now that causes a build-up of waste and a reduction of nutrients in your muscles, which is perfect for growing muscle knots. Now this is why muscle knots are so common where repeated movements or postural issues such as sitting at a computer cause muscle tightness. Now the big issue is, if you remember before, muscle knots themselves cause muscle tightness. So once you get a few muscle knots, they create the perfect environment to grow and develop more. Now you basically get a snowball effect. So what's the best treatment for muscle knots? Now the key to this is to understand that they start small, so you don't even know they're there. Then the muscle starts to tighten, reducing the blood flow, which creates a perfect environment for the lumps to gradually grow and more to develop. Now eventually some of those lumps will get big enough so when something aggravates them, they'll start hurting. So your treatment needs to settle the lump down so it stops hurting, then get rid of the lump and restore the health of the muscles. Now, there's been a lot of clinical trials testing treatments such as needles, lasers and various massage techniques, and according to them there's not a lot of difference in their effectiveness. Now, the problem is that almost all the trials just tested how well the treatment settled down the pain. Now if you want to actually get rid of your problem, that's a whole other story which I'll discuss later in the video. So how do you release a muscle knot? Well, the basic treatment for a muscle knot is called a release. This is where the bunched up part of the muscle is helped let go or release. Now, this allows the whole muscle to relax, which allows the blood to flow more freely and usually relieves the pain. Now the classic way to release a muscle knot is known as pressure release. This is where pressure is applied to the lump while the pain gradually fades. Now therapists often do this with their thumbs or elbows, but it can be done with various tools. Now therapists have been doing it like this for probably centuries, but we now have alternative ways that are less painful and often more effective. Now, examples are needles and lasers, but arguably the easiest to apply and most effective is the use of a vibration massager. Now don't confuse these with a massage gun, these are not suitable. Now to apply vibration massage, you simply put the head of the machine like this on the muscle over the lump. Now the vibrations from the machine will penetrate just like ultrasound, and it's scientifically been shown to make the lump release, relax the muscle and increase the blood flow, which is perfect for dissolving the muscle knot without any pain. So do muscle knots go away on their own, and why do they keep coming back? Now I think you probably worked that one out already. Now quite often you'll have someone who will get sore from a muscle knot and then later the pain goes away. Have the muscle knots gone? Of course not. What's happening is there will be some moderate sized lumps that will arc up when you aggravate them, then settle down. Now they're still there and the muscle is still the ideal environment for growing them, so next time you aggravate them they'll arc up again. Then they'll eventually grow big enough where they hurt all the time. Now this is exactly the same when you get some massages, needles, lasers or whatever. Now the pain goes away, you think you're fixed, but the problem is still there. Now, as a chiropractor for over 27 years, I can say this is a huge problem. Now, people get some treatment and think they're fixed, then the pain will come back and need fixing again. Now, of course, over time, the underlying problem gets worse, so it takes more treatments to fix the problem. Then, eventually, the patient goes off looking for something else to fix them and usually ends up on medications for the rest of their life. The basic way to stop this happening involves continuing the therapy for long enough after the pain goes so that the lumps continue to diminish and the health of the muscle returns to normal. Now, if you do that using professional massage needles or lasers, that would need countless more appointments, which would be very inconvenient and very expensive. Now, professionals sometimes try and get around this by prescribing self-applied pressure techniques using balls and rollers. Now, the problem is that this is hard to do, hurts like hell, and is not that effective. Now, as a chiropractor, I saw so many people hurt themselves for very little benefit that I gave it up as a bad joke. Now, that's when I had these built. Now, genuine vibration massage, as distinct from massage guns and percussion, is an excellent therapy for muscle knots. Now, all we needed is an economical, easy-to-use machine for patients that was effective as the machine's professionals use. Now, with a bit of professional advice, patients can find the lumps, sit the machine on them for 30 to 60 seconds, and it dissolves them beautifully. Now, do anti-inflammatory drugs help muscle knots? No, they don't. Now, they just relieve the pain, but the lump's still there, and the muscle's still tight, and there's still not enough blood flowing. In one clinical trial, self-applied trigger point therapy and anti-inflammatories were actually directly compared. The anti-inflammatories gave a small reduction in pain only, while the self-applied trigger point therapy gave a large improvement in pain and functionality. Now, does fibromyalgia cause muscle lumps? Well, actually it's the other way around. Muscle lumps are a big untreated cause of fibromyalgia. Now, when summary pain from untreated muscle lumps bombards the nervous system, causing it to become sensitized. Now, scientists have relieved fibromyalgia by injecting the muscle knots with anesthetics, stopping them from bombarding the nervous system. Now, of course, anesthetics wear off, so that was only a temporary solution to show cause and effect. Now, the long-term solution would be to effectively eliminate the muscle knots, which we've already discussed. Now, do muscle knots affect sports and athletics performance? Well, anytime you've got a muscle that's tight, has restricted blood flow, and contains a bunched up lump, of course it won't perform as well. And being tight will be much more prone to being injured. Now, if you can have some sort of regular therapy like massage or using one of these to find and treat those lumps, you'll be a lot better off. Now, as an example, I found a few studies where athletes were given regular vibration massages and they had more strength, fitness and endurance. Now, vibration massages didn't make the muscles stronger, they just help eliminate the problem that was inhibiting them. So, what's the difference between muscle knots and acupressure points? Well, muscle knots and acupressure points are about 97% the same points. And people have had common lumps in their muscles forever. Now, people found them centuries ago, and without the science as we know it, they made up stories. Now, in more recent times, science have investigated them, calling them myofascial trigger points, and by applying science, they've learned how to identify them, what makes them tick, and more importantly, how to treat them better. So, even though the points are basically the same, the way they're used is a lot different. Now, put it simply, a traditional acupuncturist will have a story they made up centuries ago about meridians, life forces, and whatever else they have, plus what amounts to a recipe book based on what they found with people with similar symptoms centuries ago. i.e., if you have condition A, you press on points X, Y and Z. Now, on the other hand, if you see a professional who uses a therapy based on trigger points, they will know exactly what to look for so they can find them and have scientifically worked out ways to treat them. Now, do muscle knots cause headaches? Now, muscle knots in the head and neck muscles have been shown to be a major cause of the most common form of headache, tension headaches. Now, trials where these have been treated gave excellent relief, and it's something you can easily do yourself. Now, we find muscle knots involved in most musculoskeletal conditions. Now, in the description, I'll link specific guides for conditions such as back pain, shoulder pain, headaches, etc. Now, these will show the common points involved, how to find them, and how to treat them. If you have any questions or comments, please shoot me an email or pop them in the comments. Hey, thanks so much for watching. It has been most appreciated.